While visiting in the TSICU, please keep in mind that cell phones can disrupt a patient's rest. We ask that cell phones be used only in the waiting room. Please put your phone on silence or vibrate in consideration of our patients and other family members. Each patient room is equipped with a colored television for your viewing pleasure. We offer free cable with over 40 channels to choose from. Channels 80 through 85 are educational channels and offer a wide variety of health-related topics. Ask your nurse for more details and further instructions. A communication center in each room is available for patient information that is updated every shift with your nurse's name, the date, and times of lab draws or x-rays. Occasionally, a patient may have difficulty breathing and require help. A soft tube is inserted through the nose or mouth into the airway leading to the lungs. This tube is known as an endotracheal tube or a breathing tube. This tube is then connected to the breathing machine that helps the patient breathe. While this tube is in place, patients cannot speak. They will not be able to eat or drink. Your family member will be placed on a heart monitor with an adhesive electrode. This machine allows the staff to observe the activity of a patient's heart. A picture of the heart's rhythm is shown on the monitor above the bed and at the nurse's station. Here, we have a patient's heart rate, blood pressure, respirations, and oxygen saturation. Oxygen saturation. This is a small cable placed on the patient's finger or earlobe to record or measure the oxygen level in the patient's blood. A nasogastric tube, also called an NG tube, is placed down the patient's nose, down the back of the throat, and into the stomach. This tube can be used to remove air and stomach contents. The tube can also be used to send nutrition and medications into the stomach. Once placed, this tube does not cause any pain or discomfort for the patient. Shown here is a type of peripheral IV. It is a way of providing necessary fluids, nutritions, and medications to the patients. Some patients require a large IV that goes into the vein close to the heart. This is an IV access that allows the nurse to draw blood samples without sticking the patient for blood. Here we have what's called a sequential compression device, also known as SCDs. This device uses sleeves placed on a patient's legs. Air is used to compress slightly around the legs to help decrease the possibility of blood clots and increase the blood flow to the heart. And finally, shown here is a Foley catheter. This is a small tube placed in the patient's bladder. The tube is connected to a bag and collects urine. In conclusion, we hope your stay on TSICU and also at DCH has been a good one. We appreciate the opportunity to care for you and have certainly hoped to have met your expectations. From all of us here at TSICU, we hope you get well soon.